Well, certainly good morning and thank you for coming. Central Michigan Community Hospital and McLaren Health Care have merged. Only a few minutes ago, as George said, George Dunn, Phil Incarnati, and I signed an agreement between CMCH and McLaren Health Care. This historic move basically secures the future of CMCH, retains its autonomy, and joins it with one of the top 10 healthcare systems in the Midwest and top 25 in the nation. This is a tremendous day for our hospital and our community. The CMCH Board of Directors chose McLaren because it keeps local hospitals whole, keeps jobs and employees safe, and retains the hospital's leadership team and Board of Directors to make decisions locally. McLaren supports its member hospitals as they grow to meet expanding community needs. McLaren encompasses nearly 10,000 highly regarded associated physicians, state-of-the-art technology, advanced medical research, and provides capital financing at excellent rates. CMCH is at one of the strongest points in its history. There's been a substantial increase in admissions, 5% this year alone, excellent patient satisfaction rates, 100% quality scores for meeting evidence-based guidelines, and smart business practices that have strengthened the bottom line. McLaren hospitals do not overlap or compete for patients. Rather, they are complementary, so each keeps its doctors, its staff, and its services. We're still your hospital, our hospital, and starting today, we're stronger than ever. I'd like to introduce Mr. Phil Incarnati, the President and CEO of McLaren Health Care, to say a few words.
Thank you. Good morning. It's kind of a culmination of a lot of hard work. Certainly, you all should know, if you don't, that your board, your leadership really was very deliberate in a process. I'm happy to say that we were fortunate to be the one that was involved in the end in this process. And I think you should also know that the organization had the perseverance, the foresight, if you will, to do this at a time when the organization is strong as opposed to when you're weak and you really don't have a position to negotiate from when you're weak. So oftentimes hospitals choose to let things go to a point where it becomes problematic and a lot more needs to be perhaps given up in the process. You didn't have that situation. To the contrary, you have been strong. Your situation has improved, as many of you know. Bill mentioned the volumes here. So it's a great time, and we're delighted to be a part of the family, so to speak, certainly to have you all as part of our family on a go-forward basis. I think you'll find that what we say is what we do. I take these things very personally. I have always been involved individually, principally myself in these negotiations with your board and with your management team. And again, I'll reiterate, the things that we say we will do, we will do. It is a great time, and while we were just signing the papers and saying it's somewhat anticlimactic when you think about the process that we collectively have gone through, but now the real work begins. Now we have to create the value that we talked about in positioning Central Michigan Community Hospital to even be stronger in the years ahead and to gain market share in this community and do all the things that you all have been doing and to do more of it, so to speak. So with that, again, I'm delighted. Thank you for the support that we've received. I know a lot of you haven't been involved directly, but the sense that I've had this whole time is that you have been a very willing partner, and that makes a huge difference as we go about to set out the things that we want to accomplish together in the community.